We have glimpsed the future of what life could be like having access to healthcare coverage, and I would say what this challenge offers us right now is an opportunity to make sure that progress does not get rolled back. So the most important thing we need to do right now is to make our voices heard, that access to healthcare coverage is essential to our health, and to collectively come together at this point in time to make sure that our representatives know just how important that it is.
Our providers need to reflect the patients they are serving in as much as their language, in as much as their cultural background, and in as much as their understanding and empathy from a personal level to the struggles of the limited English communities all across California.
That being said, we do face an uphill battle. And so if progress is rolled back, I think we have heard that there's a tremendous commitment amongst our California leaders, as well as the community-based organizations and partners such as Language World Services, to make sure that our communities still have access to the health care that they need and deserve.
By denying somebody communication in their language, we are dehumanizing them. We are removing their self-empowerment to manage their own life. And we are somehow saying to them that their life is not as valuable as those that speak English. I believe the interpreter does save lives. I believe the interpreter does it one word at a time, one meaning brokered at a time.
And I would say that language access is really essential there. So California is one of the only states that has standards that require health plans to provide language assistance to their enrollees. This is both in the private coverage, so for example through employer-based coverage, health plans have to ensure that their enrollees have access to language assistance services, as well as in the public programs such as Medi-Cal. And so we need to make sure that those types of consumer protections that we have in California that are very strong, that they're also maintained as we go forward, and to do what we can to make sure that we still have a really strong safety net for California's most vulnerable populations.